My name is Ann Palmer, and I am going to introduce this session. This is what works for healthy food access. Sally Mancini is going to be facilitating the session for you all. Sally is the Director of Advocacy Resources at the Red Center for Food Policy and Obesity, leading efforts to inform the public, community organizations, advocates, and policymakers about the center's research related to food marketing to children and its impact on health disparities. She also helps state and local advocates develop resources necessary to support food policy improvements in all communities. Sally has more than 15 years of experience in nonprofit development and management, advocacy, and government relations and coalition building. Sally, I'm going to turn it over to you.
Great. Thanks, Anne, for that nice introduction. I'm excited to be together today. As Anne said, I work at the University of Connecticut Red Center for Food Policy and Health, and we are a research and policy center that works to improve the food environment that surrounds children and families. We know that nutritious, healthy food plays an important role throughout our lives in promoting health and preventing disease. But where we live or how much money we earn can affect our ability to access or afford healthy food. In a similar way, we know that laws influence and shape the quality of our environments and our choices and opportunities. While policy can be a force for good, we must be careful in the way that policy is created and implemented to not reinforce structural barriers to health and perpetuate racism and other systems of oppression. We've assembled an amazing panel of folks that are working on equitable policies and strategies for healthy food access. And today you'll hear from those in rural and urban communities, researchers, and from youth leading the way. We'll also have an opportunity to use breakout rooms to dive deeper into how you can apply these strategies and policies in your community. So Anne, you can start the slide show.
And yes, the sessions are being recorded. Somebody just asked me that. So.
Okay, you can go on to the next slide. So what's on the menu for today? We are going to start with a brief welcome, getting to know you, and then you're going to get an opportunity to hear from our amazing panelists. This first part of the session is meant to get your thoughts rolling, your wheels turning, and whet your appetite and prepare you for small group discussion. You'll have a time to reflect on what you've heard, and then we're going to interact through breakout rooms with content experts and peers. And we'll end with a time of application. I really just want to stress that this session is meant to be both informative and interactive, and we want you to leave this session with concrete next steps on policy approaches that you can use in your community. Next slide, Anne. But now it's time to get to know each other a bit. In the chat, please share your name, your organization, and location, and the two strategy and or policy options you're most interested in from this list. Co-op grocery stores, rural grocery initiatives, farmers markets or farm stands, farmers market incentive programs, or urban agriculture, and healthy restaurant options. And I'll give you all a few minutes to start putting your answers in the chat. Okay, it's looking like we're getting a lot of great feedback. It's wonderful to have you all here today. And as you're continuing to put your answers in the chat, this will be helpful for us as we get into the next part of the session. So Anne, can you take us, yeah, next slide. But before we before we dive, let's dig into a few terms that we're going to use today. So what do we mean by food access? So food is accessible when it's affordable and community members can readily grow or raise it, find it, obtain it, transport it, prepare it, and eat it. And when we're talking about healthy food, we mean food that is minimally processed, fresh, frozen, or canned produce that has little, if any, added sugar, salt, or fat, food that is culturally relevant, food that meets evidence-based nutrition standards, food that is both nutritious and safe to eat. And then I just wanted to talk briefly about the difference between a policy and a strategy. So at the most basic level, a policy is a plan or course of action designed to influence and determine decisions. And policies can be written or unwritten. They often take the forms of laws, regulations, resolutions, or executive orders. They can also be organizational policies such as wellness policies or dress code policies. But for the purposes of this presentation, the policies we are discussing are most often proposed or adopted by government. And a strategy is a way to accomplish a goal. It does not necessarily require policy or government intervention. So with that, let's take it to the next slide where we're going to start from hearing from our panel today. We have Amanda Karls from Foodvocate, LLC, who's going to talk about Healthy Food Policy Project. That's a web resource for local level laws that includes a searchable database and other policy focused materials, strategies. And then we have our strategies and policy exploration. And we're going to hear from Lela Klein from the Gem City Market, Erica Blair. She'll be talking about municipalities and rural grocery stores. We have Kamryn Dease and Betty Burney talking about the Rosa Parks Produce Market, Abiodun Atoloye talking about strategies for monitoring and increasing farmers market incentives use, and Whitney Shields discussing urban agriculture. During this time, we're going to ask you to use the chat box for questions or comments, and we'll respond to you in that way. So now I'll turn it over to Amanda.
Thanks, Sally, and thanks for outlining that really exciting agenda. Sally asked me to talk to you all a little bit today about the Healthy Food Policy Project. And before I dive in about that, I'll just say briefly about myself. My name is Amanda Karls. I am a food policy consultant. I'm also an attorney licensed to practice in Minnesota where I live. All that said, although I'm an attorney, I'm not your attorney, so please don't take anything that I say today as legal advice. So just kind of jumping in, there's not a lot of time for me to talk more about myself, and that's okay because I want to hear more from you all. But I'm going to just kind of give you a brief overview of this particular resource or set of resources, really. As Sally said, it's the Healthy Food Policy Project. And I've had the privilege and opportunity to have worked on this project for several years, I think around 4 years, both in my prior capacity as an attorney at the Public Health Law Center, and now in my capacity as a consultant. And the project is a collaboration between 3 centers, really. It's UConn's Red Center, where Sally is located, the Center for Agriculture and Food Systems at Vermont Law School, and the Public Health Law Center, which is at Mitchell-Hamlin School of Law. So just very briefly, the project itself is basically it's housed on this website, very easy to find. It's healthyfoodpolicyproject.org. And it's really, I think, a great starting place for folks like you who've got a tremendous amount of opportunity to be thinking about what you can be doing, especially at local levels as it relates to healthy food policy, food access specifically. And I know that, many of you on this call are specifically on food policy councils, and that is, just you guys are the perfect target audience for this particular resource because you have so much influence over what happens, particularly at city, town, county, kind of more local levels, as well, of course, as an inability to also work on state and larger federal policy issues. But this is kind of a front page of what you might see when you land on that site. There is a policy database. as well as a variety of other resources. For example, a food systems crosswalk, which if you kind of go and explore around the site, you'll see is our way of sort of visually representing how different stages of the food system intersect with various policy options. There are also case studies. Next slide. In addition, you'll see there's a drop-down menu that hosts a variety of other resources, including past webinars, a couple of resources that relate to COVID-19 food policy at the local level again. So that's really sort of prescient right now, a great resource and something that we've had a lot of. Those tools have been very popular over the past year, as well as some really great resources as it relates to policy drafting, including one about drafting definitions for local laws. And I could geek out about these sort of policy things a lot longer, but I'm not going to just given time. So next slide, please. Also, there's a key issues drop down, and you'll see there again another set of really useful resources. One for zoning for urban agriculture that I think my colleague Whitney Shields will touch on in a bit, as well as what I'm going to talk about in just a minute around municipal policy options for healthy food access in stores and restaurants. I should also say in the resource tab, one document that I would really like to highlight is around authentic resident engagement. I think that's another really helpful resource and one that is really important as you're considering policy. Next slide. When you get into the policy database of the Healthy Food Policy Project website, you'll see that there's a way to kind of explore that database by entering a variety of filters, including keyword search terms. So that's a nice way to be able to kind of just filter through what is now a collection of 400 policies and really growing every day. We've analyzed each of those policies. So if you click into any one of them, you will see a lot of information about the policy, including things like just a brief summary of the law in sort of, layman's terms, trying to avoid too much legalese so that you all can get a sense of what the law does, why it's important, as well as some other characteristics of the law, a direct link to the law so you can go out and sort of see it typically as it's embedded in a larger set of city or county or other community level code. And another neat feature that we've added is where we've been able to identify it. We have linkages related to evidence base as they relate to the county health rankings, what works for health, diet related strategies. And so that's a really kind of cool thing where you're able to kind of, sort of find a connection between what we've identified as being a possible policy approach, and for you to be able to go in and get a sense of whether there may actually be some evidence base to support it. That's to say that just because there isn't an evidence base linkage that we've identified, that doesn't mean that there isn't something else out there that could support it, or possibly just that research hasn't been done on that particular topic area yet. So not to suggest that if there isn't a linkage that a strategy might be invalid. But my suggestion for people thinking about local level policy is to just kind of play around with that database, because I think it provides a really neat sort of a la carte menu of the types of laws that are existing all around the country, so that you can kind of get a sense of what you might be able to do in your own community, adapted, of course, after engaging in authentic resident engagement and thinking about other community specific contexts. Next slide, please. And just to kind of set the stage for what we're going to be talking about for the rest of the day, and what I'm going to just share briefly with you before I sign off, we've been asked to talk about what works to increase access to healthy food. And for a good chunk of today, some of the speakers are going to be talking about what works within the sort of retail setting. And as it relates to the food system, as we've conceptualized it for the Healthy Food Policy Project, we're talking really kind of then about what relates to the get stage of this kind of simplified schematic. But we will also hear from Whitney Shields, who's going to be talking about urban agriculture. So of course that relates just sort of the other side of the spectrum or other end of the spectrum in the growth stage. And Whitney and I will actually be both helping to facilitate a breakout room that's going to cover the growth stage, as well as talking about some restaurant environment strategies. Next slide, please. So briefly, that healthy food policy project that I mentioned, or that I talked about at the beginning, one of the resources that I think you'll find useful, especially as it relates to some of what's going to be covered today as it pertains to food stores, is this particular resource on retail policy options. It covers both food stores as well as restaurants. And so will be, I think, a kind of a helpful companion as you're kind of reflecting on what you hear today. But basically outlines just a variety of policy strategies that have been used again around the country and organizes them in sort of narrative form. So maybe a little bit easier to read through and organize, perhaps in a slightly more approachable way than just digging through the database. Next slide, please. And then just because we are going to spend a fair amount of time today talking, in the next couple of sets of presentations about, again, the sort of food store environment, and then about urban agriculture, as well as farmers markets, I did just want to sort of highlight again that, of course, there are also opportunities to be thinking about policy opportunities at the local level as they relate to restaurants. I think a lot of times we think about these being as sort of regulatory type policies, things that maybe limit saturation of certain types of restaurants, or sometimes things like SSB taxes that can apply to affect restaurant offerings, or things like healthy default beverage laws. But there are also lots of different strategy things that can be done that are more incentive based, and I love to talk about those. So if that's something you're interested in learning more about, feel free to touch base with me later or join the breakout room that Whitney and I will be facilitating. Next slide. And then finally, I just, of course, wanted to throw out there just as kind of food for thought as we're thinking about what works to increase access to healthy food, that there are, of course, other sort of venues that are not maybe restaurants, food stores, farmers markets, or gardens and other agricultural sites. And so I have a list of just some of the many other places where policy intervention can come into play to, of course, help to increase access to healthy food. And I think that's the end of my slide set. So with that, I am going to leave you with my email address. Oh, one slide back, sorry. Leave you with my email address in case anyone has any questions for me. I'm happy to respond to you, or I'll try to keep up with the chat as well. And with that, I'm going to hand it off to the next speaker, Lela Klein, who's going to talk to us some more about possibilities within the co-op grocery space. Lela.
Hi there, everyone. Can you hear me? I'm going to hope that's a yes. If not, hopefully someone will tell me. I'm Lela Klein. I'm from Dayton, Ohio. I'm talking to you from here in my hometown. You can go ahead and jump to the next slide. The picture that was up was the picture of our opening day of a co-op grocery store. So spoiler alert, we recently opened a cooperative grocery store in Dayton, Ohio. My hometown of Dayton, Ohio is a scrappy blue collar city. I've lived here pretty much my entire life. In a part of Dayton called Northwest Dayton is where I grew up. And Dayton is a city like many other cities that have been impacted by deindustrialization and the kind of economic churn over the past decade or so. And it also is a city with a history of hypersegregation and the segregation in the city, racial segregation, which has been driven by policy choices like racially restrictive covenants and redlining. There have been major impacts over the past couple of decades of the recession and the foreclosure crisis, and that's been disproportionately felt in Dayton's predominantly Black neighborhoods, which are mostly in West and Northwest Dayton. Can you go back one? Sorry, I'm using the notes to remind myself what I wanted to see. So a group of neighbors and community organizers came together back in 2015 and looked at what was called opportunity mapping, which was a sort of a geographic way to look at the ways in which opportunity and risk is distributed in our city. And we identified the challenge of food deserts, or what Karen Washington refers to as food apartheid, to indicate that it is intentional and policy driven rather than naturally occurring. We decided that we wanted to try to intervene. So the first thing we had to do was to select a site that we felt would meet our mission, but also be a site that a grocery store could succeed at. So we did that with a market study and some surveying and some, involvement in the community, conversations, open meetings, things like that. Once we settled on a site in Northwest Dayton, then we moved on to our pre-development process. So it's been a highly, you can go forward. Yeah, thanks. It's been a highly participatory pre-development process. So we had community engagement and input from the beginning. So a cooperative business, if you're not familiar with one, is a business that is owned by its key stakeholders. And in this case, it's owned by the community. The actual community that it serves is the owners of the grocery store. So starting in 2017, after some business planning and development, we actually started selling member ownership shares in the community. We started having monthly community meetings where people would vote. You can see in this photo, the red and green cards was how we voted yes or no. We also did surveys. We had the architecture, even just with the architecture, the architects did open office hours with the whole community. Lots of voting, lots of democracy. We had a capital campaign to raise some philanthropic funds to support the project, and some key hunger advocates in the city helped us with that. And then we built strong partnerships within the community, and were able to use grant funding to actually do much of the pre-development work in order to support the market. Next slide, please. One big challenge for and I see a question in the chat, one big challenge for a project like this is access to capital. So we had to be really creative for how we could bring capital into this project. So we have membership, that's our owner base, that's our kind of our bread and butter. So some of the folks in this picture, actually all the folks in this picture are owners of the grocery store. Our ownership share cost $100. So for $100 investment, people in the community could become an owner of the store. We also made a $10 ownership share available to anyone who identified as being low income or being on SNAP or EBT, or people who were on a fixed income. And we subsidized that with donations from the community. And then at certain points, we would do a 50-50 match with various partners. So we could try to make membership affordable. We had supporting members who just essentially didn't live in our neighborhood, but wanted to support us. So they donated. Those are non-voting members. And then we were really creative with financing tools. So we had program related investment, which is like a loan from a foundation. We had a loan through a CDFI, through the Healthy Food Financing Initiative. And I can get into the weeds in our breakout on this. We had grants and donations from foundations and individual donors. And then we also had a lot of local, state, and federal government support and new market tax credits. We did not do preferred shares, and I can say more about that in the small group. Next slide, please. So the store itself is 15,000 square feet. That is actually only about 8,000 of that is retail. It also includes some community spaces like a teaching kitchen and a community room. It'll also be owned by its employees. Once the employees have been there for a little while, they'll own it 70%. It's owned 30% by the community. This slide is out of date. We actually currently have over 5,000 members, and more than half of them are in our local trade area. And just over, at this point, 13% of our members self-identify as being very low income. Next slide, please. So the market has a goal of having 20% local products, including produce, meat, pantry staples. Right now we have about 6 farmers that are supplying to us, and a lot of other small kind of entrepreneurs, including coffee makers, people who make cupcakes, things like that. But we have a lot of room to grow in that area. We'd like to have more involvement from farmers. I said we had a teaching kitchen and a community room, and we also have a health and wellness committee from the community kind of informing what we do. Next slide, please. Is that the end? If you hit the button, I think this is a slideshow. Just hit the next. Yeah, there you go. I think a picture tells more than words. So this is when we were under construction. Next, just click again and you should get more. This is one of our board members, Shavelta Harding, giving a tour to some of our community owners while we were under construction. Next slide. This is sort of how we kept the community involved. So this is opening day, people waiting to come into the market. Next click. Here's some of our, you can keep clicking through actually. These are some of our early shoppers. This is Robin is our customer service manager. Here's an event we had in our community room. You can keep clicking. This is in our teaching kitchen, somebody teaching a class on how to make healthy snacks. This is what the teaching kitchen looks like. Next click. Here's when we did our produce perks, our dollar for dollar match on produce for SNAP recipients is a launch that we had. Next slide. And this is our board president, Amaha, giving a tour recently of the store. Next slide. And this is my email address in case you want to ask me any questions. And I will pass it to, I think Erica is going to talk about rural grocery initiatives.
Yes, thank you so much. So hello, everyone. My name is Erica Blair. I'm with the Rural Grocery Initiative, which is part of Kansas State University. And I'm really excited to be here today. We wanted to give you some ideas that you could take with you to your communities. So I'll be focusing on how municipalities can support rural grocery stores as we are seeing this happen more and more across Kansas. Next slide. So to start, I wanted to provide some context. So on this slide, we have a map of Kansas. The census tracts that are shaded in purple are considered areas with low access to food, according to the USDA. So as you can see, this encompasses most of the state, and most of these communities are rural. So why is this? What are the barriers to food access in rural Kansas? Well, many of these places, as you can imagine, are remote. So distance to the nearest grocery store becomes a primary barrier. Sometimes people are driving 30 or 40 miles round trip just to get groceries. But then this also begs the question, why do so many rural communities lack grocery stores in the first place? And here we get into some of those underlying issues. So rural areas are experiencing population decline. This means they have less purchasing power to support these businesses. Another challenge they face is that grocery stores often have minimum buying requirements. So in other words, they're required by their distributor to purchase a certain amount of goods per week. But in rural communities, sometimes these grocery stores maybe can't purchase that much, or they don't need to stock that much at the store. Rural grocery stores also face competition from chain supermarkets and increasingly from dollar stores, which makes it more difficult to stay in business. And finally, many grocery owners are nearing retirement. So the question is, who will take over the store? And it can be a significant challenge to find someone, given that this is a difficult business with very low profit margins. So this is not a comprehensive list of barriers. These are just a few of the challenges that we often hear about in our office. And this is not unique to Kansas by any means. Next slide. So our office has seen municipal governments engage really closely on this issue, recognizing that the future of their communities really depends in large part on food access. It really is an existential question. So when the traditional model of having a single independent operator is no longer working, these communities really have to think outside the box. So two innovative grocery models that I want to highlight are municipally owned grocery stores and public-private partnerships. So I'll provide a very brief overview now, and we can go into more detail in the breakout session. So first, the municipally owned grocery store. We have at least 3 examples of this model in Kansas. So here, the primary player is the municipal or county government. So they would own the property, the building, the business, and the inventory. And in this case, the grocery store is essentially treated like a utility, like water or electricity. So the store is supported by local tax dollars. It often requires input from community residents, which could be in the form of a survey or a vote. And there are several benefits to this model. So first, it has long-term buy-in from municipal leadership to support the store. Second, grocery store employees are also considered municipal employees, so they often will receive retirement or health insurance benefits, which can help attract and retain staff. And finally, because the store is being treated as a public good, there is less pressure for them to make a profit. And instead, they're really just trying to cover their expenses. Next slide. So the second model here, public-private partnerships, is a model where different parts of the business are owned by different entities. So the public entity could be a municipal government or maybe an economic development corporation. And the private entity could still be an independent business person. So we have examples in Kansas where the public entity owns the building and maybe even the equipment, while the private entity still owns the other parts of the business. So what are the benefits? Again, this model has long-term buy-in from others in the community, so it's not all on the shoulders of a single independent operator. There's also the potential to access more funding sources. So public entities could be eligible for different grants that a business wouldn't necessarily access, and vice versa. It also means when the business owner is ready to move on, there is someone else there to help with the transition. So the public entity has an incentive to help find another owner or another manager of the business. So that's just a really brief overview of those two models. I also wanted to point out that there are other community-supported grocery models across rural Kansas, including a school-owned grocery store, several nonprofit groceries and cooperatives. And I really believe that we will continue seeing more and more of these community-supported grocery stores across rural America. Next slide. So could these models work in other regions and urban communities? As you can see on the right, there is a city-owned grocery store in rural Florida. So we have an example from a different region. But I have to admit that because our office focuses primarily on rural grocery, I don't have many examples of these models in urban communities. We know of cooperatives and we know of several nonprofit grocery stores, but I would be very curious to hear from you all in the chat if you are aware of other examples, if you know of city-owned grocery stores or public-private partnerships in other regions and in urban communities. So finally, we know that there are numerous other municipal interventions to support healthy food retail. I have a list here just to give you some ideas of what else has been done and what can be done in rural and urban communities alike. And I will just end by saying that it is so crucial to engage the community during this whole process. The projects that make the community a part of the planning process and truly address their needs are going to be much better positioned for long-term success. So thank you so much. That's all I have for now. I'm excited to continue the discussion in the breakout session. We have other resources online that we can provide links to in the chat. And now I will go ahead and turn it over to Kamryn Dease and Betty Burney to discuss farmers markets and farm stands.
Good afternoon, and thank you so very much. I'm Betty Burney. I am the Executive Director and founder of the I'm a Star Foundation, where STAR is an acronym for Smart, Talented, and Resilient. So our youth leaders are empowered to believe that they can make a difference in their community and in their city. Today, we'd like to talk about a unique endeavor to increase healthy and nutritious food access in urban areas. And our organization is youth-led. So I will now turn everything over to Kamryn Dease, who's a student, and she will do the presentation for us. Kamryn.
Good afternoon, everyone. I am Kamryn Dease, and I bring you greetings from Jacksonville, Florida, where I am a 10th grade student leader in the I'm a Star Foundation. Today, I am here to inform you on how my organization develops solutions to food deserts in our city and how we spurred adults to create policies to address this issue. In 2012, The Amastar learned that thousands of people in Health Zone 1 did not have access to fresh fruits and vegetables, and that most corner stores only sold junk foods and sodas. To find a solution, the students started a program called Healthy Corner Stores, where they convinced owners of corner stores to sell fresh produce. The Corner Store Project was making a huge difference in calling attention to the fact that something must be done about food deserts in Jacksonville. Next slide, please. Jacksonville, Florida is the largest city by land area in the United States. And with all of that land area, transportation is very important. Jacksonville is divided into 6 health zones, and our focus today is going to be on Health Zone 1. This is considered the most urban area and an area with the most food insecure people. And by food insecure, we mean people who have a consistently limited access to healthy foods to induce a healthy life. Almost 180,000 people in Jacksonville are considered food insecure. This is enough to cover the entire city of Chattanooga, Tennessee. The lack of healthy food options means residents rely on less healthier foods since they are not able to have enough access to it. So Amastar students did a focus group in Health Zone 1 to find out more about healthy food access. Sadly, some of the participants stated that in order for them to get fresh produce, they had to dumpster dive. A great deal of participants stated that they needed the nearest grocery store that was miles away, but they did not have transportation to even get to those stores. This area of Jacksonville had very few solutions, but still faced several barriers. In addition to our 3 corner stores, there was the Jacksonville's Farmers Market, which offers a great opportunity for citizens to get fresh fruits and vegetables, eggs, seafood, and herbs. It's a great oasis that is right in the middle of the food desert in Jacksonville. However, there is a major barrier. It is imperative that you need transportation in order to access this. It's not centrally located. There's also the Riverside Arts Market that operates from 10 a.m. to 4 p.m. Saturdays under the Fuller Warren Bridge, where they feature a number of fresh fruits and vegetables, but they frequently run out. Again, the major barrier is the need of transportation. And of course, Health Zone 1 is full of corner stores that are not stocked with fresh produce. With all of that being said, the student leaders in the Amastar Foundation decided that something needed to be done. Something different, something unique, something that needed to make a major dent to decrease food insecurity and eradicating food deserts. In 2016, Amastar teams partnered with the Jacksonville Transportation Authority to open the Rosa Parks Produce Market, right in the heart of Jacksonville. It was right at the Rosa Parks Transit Station, which is a major bus terminal. Thousands of people come in and out of the hub every day. The produce market is set up inside the hub, which can be easily seen and accessed by people getting on and off the buses. The Amastar students own and operate the weekly market, creating access to fresh, healthy, local fruits and vegetables for thousands who live in food deserts or areas 5 miles or more from a grocery store. Additionally, the Rosa Parks Transit Center is centrally located in the heart of the city, which means that in addition to bus passengers, it'll be available to individuals who live in the inner city, students who attend local colleges, and individuals who work in downtown areas. The most important step in developing the Rosa Parks Produce Market was to collaborate with people and organizations who could advance this project. The first picture on the slide, next slide, please. This shows a major act of collaboration from day one. The first picture on the slide is the ribbon cutting for the Rosa Parks Produce Market. The person on the far left was a chief executive officer of the health department, which allowed us to have an individual who could encourage people to buy from the market because of these healthy aspects. The young lady next to the health department CEO was an Amastar student and president of the produce market. The gentleman in the center of the photo is the CEO of the Jacksonville Transportation Authority, who showed the media and all of Jacksonville that he was 100% behind this project. And he was also the first customer to make a purchase to encourage all of his employees to purchase from this market. The person next to JTA's CEO is Betty Burney. on this meeting, Amostar's executive director, who is on the Zoom meeting with me today. The lady at the end was a school board member and the coordinator of the Clinton Foundation's Northeast Florida Health Initiative. Her presence was vital in getting schools to support and organizations aligned with the Clinton Foundation. As you can see from the pictures on the screen, this was a huge gala event. The media from all of the TV stations and newspapers were there to report on this unique project, and Amostar invited every organization that is affiliated with the organization to attend. Next slide, please. The pictures on this slide paint a picture of the produce market's impact. The first picture on my left shows a bus driver purchasing fruit. Bus drivers love the market because they could hop on and off the bus to get a quick, healthy snack, and many of them would place orders to pick up after they got off their shift. The picture at the bottom left is a snapshot of one of the produce stands. The center picture is very, very important because its parents traveling with their children often came to purchase fruits and other fresh produce. The kids that often ate the fruit between bus transfers or while waiting to board the bus. The picture at the top right shows Amostar students after making a scale to one of the many transit authority workers who would come in and on the Skyway Express to purchase fruit for their lunch. The bottom picture is one of the many loyal customers who would purchase her produce for the week and did so for every single week for 4 years straight. As a result of the pandemic, the produce market had to be closed due to the risk associated. Next slide, please. Amostar students have been at the forefront on creating innovative ways to get produce to individuals residing in food deserts. Our executive director shared concerns with the city council members and community leaders. City council plans to review ordinance 2000-245, which seeks to adopt the full service grocery store program, in an effort to determine solutions to bring healthy food stores and educational programs to Northwest Jacksonville. It follows ordinance 2018-195, which appropriated $3 million from the Northwest Jacksonville Economic Development Fund to develop programs to improve affordability, education, and promote access to healthy food. That ordinance was enacted in March 2018. A portion of the money was used to hire a consultant to evaluate Northwest Jacksonville food deserts and recommend incentive programs for long-term solutions. Northwest Jacksonville has the largest concentration of food deserts in Jacksonville. Jacksonville's vast land areas make it a city that has large areas which are rural, suburban, urban, and the beaches. This project is easily adaptable in any type of setting. Next slide, please. Thank you for this opportunity for me to share how a group of students changed the landscape of food deserts in Jacksonville, Florida. Thank you. Oh, I will pass this on to Abiodun. Oh, she's got it.
Thank you, Kamryn. Hi, everyone. I'm Abiodun Atoloye. I'm currently a postdoctoral research associate at the Rhodes Center for Food Policy and Obesity, where I studied food access as a solution and determinant of nutrition health disparities. I would like to say thank you to our host, the Food Policy Network, for creating this opportunity to share space and to talk about this important topic on food access. I will be talking about research-based evidence on 2 different strategies that was used in addressing 2 key issues in the farmers market programming, the farmers market incentive programming in Utah State. And these 2 strategies were designed to help monitor and evaluate the impact of farmers market incentive on the local food system. And 2 was to address a key barriers in the uptake of the program among the target population. Next slide, please. As we all know that access to fruit and vegetables is a challenge among low-resource families as well as in underserved communities. The USDA Food Insecurity Nutrition Incentive Program was first introduced in the year 2014 Farm Bill, and it was designed to address the financial barriers to fruit and vegetable purchase by increasing the purchasing power of SNAP recipients and also supporting the local farmers. Next slide, please. The SNAP incentive, the FIN incentive, which is also known as the SNAP incentive, operates in different ways across the United States, ranging from the variations in the different types of retail outlets or how much dollar can be redeemed or the mode of redemption. For the purpose of my presentation, I will be focusing on how SNAP incentive works at a farmer's market. And so for a SNAP recipient to earn the SNAP incentive, they need to use their EBT card at a participating farmer's market. At the Utah State, where this study was located, it is also called the Double Up Food Box Program, and the SNAP recipient has to approach the booth to inform the operator how much he or she is going to spend from the SNAP benefit for that day, and $1 for every dollar spent up to the amount of $10 at that point, at that time when the study was conducted, would be given. And then the individual is able to go home with more fruit and vegetables. Next slide, please. So the first strategies that I'm going to share with you today was born out of the interest of the Department of Health at Utah State to understand how the SNAP program works in benefiting the food system. And to address this, we use a simple tracking system where we issued out a sticker that has a 4-digit number, and the SNAP recipient will still approach the booth like every other day, get their dollar in the Double Up Food Box token amount. And the operator has a responsibility of taking down some data that would include the 4-digit number, how much SNAP dollar was spent that day, and how much Double Up Food Box token was given. And so the individual would still go home with their fruit and vegetables. This simple method helped us to track the specific people that were coming to the market, how much SNAP they spent, and how much Double Up Food Box program they received in exchange, as well as a number of times they visited the farmers market over the course of the farmers market season. Next slide, please. Using this method, we were able to identify about 60% of the SNAP dollar to be related to the amount that was going into the local food system through the Double Up Food Box incentive. And on the right, you see this plot is helping to show the different types of users that were coming to the market. You see that we have a fewer frequent shoppers and more people that come less frequently to shop at the farmers market. And this helps to inform information that can be leveraged to improve the programming in subsequent years. Next slide, please. So the second strategy was directed at addressing the barriers to the use of the program identified as lack of awareness. So for this, we recruited some SNP recipients and asked them if they know about the Double Love Food Box program and help them identify specific participating market that is close to where they reside. That was done at the beginning of the farmers market season. Then subsequently at the farmers market season, we collected information about their use of the program after they have become aware of where specifically they can use their EBT card to earn this incentive, and also collected information about their change in fruit and vegetable intake over the period of time, both at the baseline, the mid-season, and at the end of the season. Next slide, please. We found that the creation of awareness was helpful because there was more than 100% increase in the number of participants who used the program at the end of the season. And on the right, you see the graph showing a difference in the fruit and vegetable consumption. We have those who use Double Love Food Box consuming more fruit and vegetables compared to those who did not use the Double Love Food Box. Next slide, please. Overall, we'll see that these two simple strategies were effective in addressing the need of the interest group, which was the Department of Health. However, this might not be applicable to every community, but can be adapted to meet their specific need. And one good practice would be to identify the needs specific to a community in terms of who and what needs to be addressed. Then we can identify specific strategies that will be tailored to meet the needs of the audience. Next slide, please. Thank you for listening, and this is all I plan to share with you. I would turn it over to Whitney.
Yes, thank you. Hello and welcome. My name is Whitney Shield, and I am the project manager at the Center for Agriculture and Food Systems at Vermont Law School. I am calling in from South Royalton, Vermont, or Abenaki land. I'm also part of the Healthy Food Policy Project team, which was described earlier in this presentation. I will be co-facilitating the Urban Agriculture Breakout Room along with Amanda Karls. During the breakout session, we are available to discuss any questions you have about updating zoning codes for urban agriculture.
Whitney, I'm sorry to interrupt you. Can you move closer to your microphone? People are having a hard time hearing you.
Oh, sure. I'm going to go off camera. That's okay then.
Okay.
Yep. Is this a little bit better for everyone?
Can you keep talking for a minute?
So just to go back,
yes.
In the breakout room, we are going to share a few policy examples of municipalities that encourage and support urban agriculture and tangible action steps to change your municipality's zoning code. I invite people to join our breakout session if you are interested in increasing food access through urban agriculture. What is zoning and why is it important when it comes to healthy food access? Zoning is a regulatory tool that local governments can use to control what is allowed on an area of land within the city. Zoning codes frequently restrict or prohibit agricultural activities, especially in residentially zoned areas. This can create barriers to healthy food access. What can we do to improve access to healthy food? Updating zoning codes to remove restrictions on agricultural uses has the possibility to increase residents' access to healthy food. For example, allowing residents to grow their own food or encouraging small growers to produce food in food insecure areas can increase access to healthy food. Local governments can create a mixed use land pattern that incentivizes healthy food production in all zones. Next slide, please. Here is a list of some ways these barriers can be addressed through policy. For each bullet point, we also have examples of municipalities throughout the United States that have updated their codes, which I'm not going to go through right now, just given the time limitation. However, I do want to point out including equity language in the zoning code, which is the last bullet point on the slide. Without specific goals and policies to ensure access to marginalized communities, urban agriculture can actually deepen inequities by benefiting community members with greater access to land and resources while leaving others out. In order to ensure that all residents are able to grow or access agricultural products in their communities, cities must draft their zoning changes with equity in mind. Next slide, please. So please join my colleague Amanda and I in the Urban Agriculture Breakout Room to learn more. We will provide tangible action steps you can take to increase access to healthy foods, provide more policy examples, discuss equity through authentic resident engagement, and answer any questions you may have. Thank you. Take it away, Sally.
Great, so thank you to all the presenters for giving us some really interesting policy and strategy options to think about and reflect on. And so now we're giving you an opportunity, 5 minutes, to individually respond to these 2 questions. You can do this, you don't have to be on camera, you can do this individually, and then come back we'll reconvene at 4:35, so I guess a little bit more than 5 minutes, and then we'll go into the breakout rooms where you will be able to talk with content experts and peers on specific strategies and policies to improve access to healthy food. Welcome back, and Anne, I'll ask you to go to the next slide. So now we have an opportunity to interact with one another around these 4 different strategies. We'll be opening up the breakout rooms in a minute, and we'll allow you to choose the breakout room that you'd like to attend. So breakout room 1 will be discussing co-op grocery stores. Breakout room 2, rural grocery initiatives. The 3rd breakout room will look at farmers market, farm stands, and farmers market incentive programs. And then the 4th breakout room will cover urban agriculture and healthy restaurant options. So I hope the breakout groups were a time for you to connect with others who are interested in similar policies and strategies, and that you were able to get some of your questions answered. I do want to let you know that we'll be sending out this slide deck and all the resources that we mentioned throughout our time together after the session. So if you were frantically trying to write things down and you feel like you need access to those resources, you should be getting them. And you'll have all of our contact information through the slides. So please reach out to us individually or as a group. We're really happy to continue the discussion on these strategies and policies after this session. So I just wanted to end today with going through turning your community vision into a healthy food law or policy. So some of you may be in a place where you know you need policy to advance access to healthy food in your community. And the Healthy Food Policy Project recently put together a policy drafting companion guide that's linked in the slide deck. I encourage you to take a look. And I just want to go through 3 key considerations today when you're starting to think about drafting policy. So it's really important to advance racial and health equity in all policies and to think through how a policy may impact health outcomes and health inequities, particularly for Black people, Indigenous people, and all people of color. And this really requires intentional, conscious decision-making, and there are racial equity tools that can aid local governments in advancing racial and health equity. And we include links to some of those tools in that resource. Another consideration for equity is that a law or policy is only as good as its input. So as laws and policies are being developed, they should be led by community, and authentic resident engagement allows for an inclusive process in informing, designing, implementing, and evaluating food access policy change. And so we will include a link to that resource as well. For policy drafting, it's really, it's important to understand two key things. One, how preemption at the state or federal level may limit local authority. So local authority to act on a specific issue may be limited by state or federal law. And as a result, the scope of local action available may be narrowed. It's important to use words that are carefully chosen because words matter. For example, even simple words like shall or may determine whether there's an obligation for government to do something or not to do something. And so for this reason, we encourage policy drafters to work with with government attorneys or tribal attorneys or another attorney to confirm that all language has the meaning that they intend it to have. It's really important to avoid ambiguity and be precise in the language that's in the law, because both policymakers and the public need to understand the law, what it intends to do, and the duties it imposes. A law or policy that is vague may lead to compliance or enforcement problems and is definitely more vulnerable to legal challenges. And lastly, considerations for collaboration. You can seek out legal expertise through a local government attorney or others. They can help resolve legal issues raised by a policy, such as the preemption issues that I was talking about before, and identifying local laws that may need to be repealed or amended to avoid undermining or conflicting with your policy. And in certain circumstances, it may make sense to recruit a champion from among local policymakers, but it really depends on the nature of the issue and your community context. So from here, Anne, we can go to the next slide. We hope that you will walk away from this session with at least one thing that you can commit to increase access to healthy food in your community. Hopefully through your own personal time of reflection and then interacting with content experts and peers, you're in a place to advance a specific policy or strategy in your community. You're further along than you may have been before coming to this session. And again, I want to thank all the amazing panelists who joined in today. I learned so much through your presentation.